Good afternoon, respected judges, on all the delegates of AIOC2022. Myself, Dr. Alankrita Hazarika, postgraduate trainee from Assam Medical College and Hospital. The topic of my today's presentation is unilateral ocular myiasis. It is co-authored by Dr. Paramiz Farali and Dr. Dipanjan Ghosh. So starting with the introduction, Maya is a Greek word meaning fly. Ocular myiasis is a condition caused by infestation of ocular and acnate cell tissue by fly larvae. It progresses rapidly, destroying all the orbital and periorbital tissues, along with bony erosions leading to intracranial extension. So my case is a 25-year-old emaciated female presented with blood mixed teachers from right eye for 15 days, pain in the same eye for 15 days, and foreign body sensation for 10 days. She is also a known case of psychiatric illness with a habit of forgetfulness which landed her up in a swampy area, later rescued by the localites 2 weeks after her missing complaint was lodged. So in general examination, the patient was not oriented to time, place and person. Her build and nutrition was poor, vitals were stable except that her BP was low. She was found in an afebrile state and ulceration was present in the right thumb. So coming to the local examination of the right eye, ulceration and maggots were seen in both the lids of the right eye. Conjunctiva was grossly chemosed. Ulceration and necrosis was seen more in the palpable conjunctiva parts along with some hemorrhagic spots. However, the cornea was clear, pupil was round, regular, reacting to light. Visual acuity and extraocular movements could not be assessed at that time as the patient was not oriented. Left eye findings, periorbital swelling was found. So this is a clinical presentation of the patient at the time. So coming to the hematological investigations, RE blood was deranged with low hemoglobin, high total count. ESR was also high. Serum electrolytes was also deranged with low level of sodium and low level of potassium. Urea was high and creatine was within the normal limits. Total protein was low. Albumin and globulin was low. And coming to microbiological parameters, viral markers were non-reactive, and entomological evaluation revealed that the larvae were the species of Chrysomia vagina. And in radiological investigation, right-sided preseptal swelling can be seen. So a multidisciplinary approach was made consisting of the ophthalmologist, physician and the psychiatrist. Mechanical removal of the maggots with forceps and turpentine oil was done under local anesthesia. Mechanical debridement of the ulcerated area was done under local anesthesia. Infiltration of the wound with 10% provident iodine was done. Dressing was done with eye ointment moxifloxacin. Initially, it was done 3 times daily for 3 days, and then it was done twice daily till when the patient was discharged. So systemic treatment includes a single dose of tetanus toxoid injection, piperacillin and tazobactam 4.5 gram TDS daily for 7 days was given, along with infusion metronidazole and iron sucrose. Ivermectin was given, and anti-inflammatory and vitamin C was given as an adjuvant therapy. So the results, the patient got oriented to the surrounding from the 3rd day onwards. Wound was free of larvae from the 4th day. Edema subsided gradually from 6th day onwards. Fresh granulation tissues appeared simultaneously. Serum electrolytes returned to a normal within a week later. The patient was discharged on 9th day. Visual acuity at the time of discharge was 6/9 on both the eye. Complete resolution of edema was seen after 2 weeks of follow-up, and the wound healed by secondary intention. So this is a picture of the patient on the 1st day, 3rd day, 9th day and 18th day respectively. So coming to the discussion part, orbital involvement occurs in 5% of all the myiasis cases. It is predominantly present in tropical and subtropical region with warm weather. Chronic debilitating conditions like leprosy, diabetes mellitus, open wound, fungating carcinoma, psychiatric illness, intellectual disabilities, poor hygienic condition may predispose the individuals with myiasis. Infestation with Chrysomia vagina differs from usual maggot infestations as it can infect the tissues without pre-existing necrotic tissue and cause extensive damage to the living tissue if left untreated. Vision is usually restored if treatment is done in early stages. Successful treatment of myiasis depends upon the stage of presentation, severity and associated predisposing conditions. So these are my references, and thank you for patient listening.